So I'll just give an outline of the program so that we are all together in terms of what to expect. So the outline. All right, there we are. So we'll have a brief introduction of the Make Way program, and then an introduction of intersectionality in relation with SRHR by Grace Namataka from AMWA. And then the presentation of the website by Caroline van der Molen, and presentation of the toolkit, which is an overview of the toolkit, and we'll have a panel discussion, which will be highlighting the 3 tools, and Lisa will be leading, and then we'll finish off with a roundup with responses and questions in relation to the presentations that have been given. So I'll give a quick intro of the Make Way program. It's a brief, and I'll ask for your indulgence as I give an overview of the Make Way program, because this is the 3rd year and you may like, all right, we know about the program. But I just hope, you know, they say repetition enhances retention. So I hope in the repeating, something new may just, you know, you may be able to make a new connection that you've never really put together. Okay, so we'll proceed. So the Make Way program is one of the strategic partnerships on sexual and reproductive health rights, which is funded by the Netherlands Ministry of Foreign Affairs. And it's promoting a new way of addressing barriers to sexual and reproductive health rights issues by applying the concept of intersectionality. So through intersectionality, we seek to understand and explain the complexities of inequity in the world, and we focus on how power and oppression intermingle with people's circumstances and affect them socially, economically, and politically, among other dimensions. I forgot to mention that I usually have a very melodious voice, but because of a cold that I'm fighting, my voice may sound a little different, but bear with me. Next time you have my voice at its best. All right, so we'll move. Now, the Make Way Consortium comprises of Akinamama Africa, the Circle of Concerned African Women Theologians, the Forum for African Women Educationalists, Liliane Fons, VSO Netherlands, and VEMOS. And this is in partnership with the Netherlands Ministry for Foreign Affairs. Included also are 45 local civil organizations that we work with as collaborating partners and allies. And the program is in Eastern and Southern Africa, namely in Ethiopia, Kenya, Rwanda, Uganda, and Zambia. And so we are at a regional and also global level. Now, what's our vision? Sexual and reproductive health and rights for all. But this vision has not been realized due to multiple and compounded vulnerabilities, especially young people. And for the realization of sexual and reproductive health rights for all, change is needed. And change is needed by youth facing compounded vulnerabilities, speaking out collectively in defense of their sexual and reproductive health rights, and holding duty bearers to account, particularly in policy development. And then duty bearers formulate and implement strategies, policies, and plans with an intersectional lens for sexual and reproductive health services that are up to standard. And then last but not least, society at large respects the sexual and reproductive health rights of all, including youth facing multiple compounded vulnerabilities. Recently in Kenya, Cabinet Secretary for Health made a very interesting statement. And so I think in the Kenyan context, we'll really have to pull up our bootstraps to see how best we can get her as a duty bearer to formulate and implement policies with an intersectional lens to ensure that young people are able to access their rights. All right. Now, what's our strategy? This is a 5-year program, and as I did mention, this is the 3rd year. And we aim to promote innovative practices in intersectional SRHR advocacy by adapting and developing new types of tools to reveal and analyze the complexity of sexual and reproductive health rights inequities and identify solutions. We also seek to support mutual capacity strengthening with a wide range of organizations and representatives of youth with compounded vulnerabilities to take up intersectional SRHR advocacy and push for structural and systemic change, and then roll out lobby and advocacy designed through an intersectional lens led by young people facing compounded vulnerabilities to claim their sexual and reproductive health rights. All right. Now, what's our methodology? Meaningful youth engagement. And when we say meaningful youth engagement, the youth are right in the center of all that we do. So we work structurally with advisory groups of young people who are facing compounded vulnerabilities in each implementation context and at the program level. Through the youth panels, young people bring their realities into the heart of our work. So they speak for themselves. Nobody speaks for them. They speak, they articulate their issues as best as they know. And then they have a mandate to advise on programming at all levels and co-create with the consortium partners and the implementing partners. And then young people are proactively involved in the implementation of the program activities. So this is a youth-led, youth-owned, youth-managed program. Thank you very much. So that is a brief intro on the program. And next we'll move into the introduction of intersectionality in relation with SRHR, which will be presented by Grace Namataka from AMWA. Grace, please proceed.
Thank you very much for that introduction. Good morning, everyone. Thank you for joining us this morning as we unpack intersectionality and as we launch our website. As introduced, my name is Grace Namataka, and I work with Kina Mama wa Africa. So next slide, please. We've mentioned intersectionality a couple of times, and you cannot talk about the Make-Way program without mentioning intersectionality. But I just want us to have a common understanding of what it means. So it is a concept that recognizes that gender does not operate in a vacuum and emphasizes the importance of considering different axes of oppression. What this means is that it refers to the simultaneous ways that oppressed people experience multiple oppressions based on their multiple identities. It is not just a concept, but it's also a lens. It is a framework through which we see where power comes and collides and where it interlocks and intersects. It allows us to not to isolate a gender problem or a race problem or a class problem or an able-bodied problem, but to view it as these layers of identities that are all on one person, because seeing it as separate problems would erase what happens to people who are subject to all these forms of identities. Intersectionality also applies categories of gender, ethnicity, race, sex, class, sexual orientation, and disability to contest the hierarchization and compartmentalization of different angles of social distinctions. What this means is that we do not just look at oppression from one point of view or from one category. We look at oppression by looking at an individual and all the different forms of identity that form this one individual. It's not just a woman. It's not just a young girl. It's a woman. This woman might be an LBQ woman. This woman might be a sex worker. This woman might be a woman living with HIV. There might be a woman living in a rural area, or there might be a woman with disabilities. So all these forms of identities are presenting with this one person. And once we work on SRHR, we do not just look at her as a woman. We take into consideration all the other identities that form her as a complete individual. And through that lens, we are able to address the SRHR needs in consideration of all these different identities that form this individual. The multiple identities of a person or a community result in power imbalances creating a vulnerability or a privilege. Thus, intersectionality makes us aware of power and privilege, who has it and who does not, and serves as a starting point for truly inclusive equity and justice work. What this means is that even in a group of marginalized people, there is always power and privilege. If we look at it through an intersectional lens, you realize that a woman who's struggling to access their SRHR needs and their issue is just maybe getting contraceptive care, does not experience oppression the same way a young woman who's a sex worker or who's an LBQ woman seeks to realize the SRHR. There will always be power and privilege within even the same group of women or even the same group of youth. So us looking at all these multiple vulnerabilities to form this one whole person helps us to also acknowledge where does the power lie, even in these groups of people that we're trying to work with, and where does the oppression lie, who's mostly oppressed and who has some privilege within this group. Next slide. So why is intersectionality very important? It's because it underscores the need to leave no one behind, regardless of gender, age, ability, class, or whatever form of classification, which is critical for the attainment of the Sustainability Development Goals. It also requires that we center the voices and experiences of the marginalized and vulnerable, which translates into everyone's rights being upheld. If we begin our analysis from the default position of just power and privilege, then groups with compounded vulnerabilities will be left behind. What this means is that we will not just do this work from just one point of view of just analyzing power and privilege on the basis of gender, because that means so many people will be left behind. If we are just looking at women or youth, a group of youth, without looking at the different identities that make them minoritized in the community, then we'll be leaving very many people behind. And we also want to work towards the attainment of the SDGs, which emphasizes leaving no one behind. And intersectionality also helps us to understand who is left behind, why are they left behind, and how, by enabling attention to the intergroup and intragroup differences, the social positions which exist at the crossing of multiple axes of inequalities. Next slide. Next slide, please. So, intersectionality in relation with SRHR. We've tried to understand what intersectionality is, why it's important, but why is it very important to SRHR? It's because compounded vulnerabilities define an individual's marginalization in exercising the SRHR within society, groups, institutions, and structures. Yet the traditional approaches to SRHR focus on one type of discrimination and thereby work to address only that specific concern. This means they address the symptom of power instead of tackling the roots. So intersectional SRHR requires focusing on the issue at hand as a structural problem and therefore confronting the power structure itself. So why we apply an intersectional lens to our SRHR work is because we do not want to just treat the symptoms of oppression. We want to uproot them. We want to tackle them from the root. That's why it's important to look at power, not just from one point of view, but to analyze it from an intersectional point of view to help us identify the different forms of vulnerability and oppression that exist within a group of people. Next slide. Intersectionality also offers a frame of analysis on how different identities that an individual or a community holds affect their SRHR. And this overlap of identities can either, number one, oppress, disempower, and discriminate. For example, when people are being left behind and remain excluded from mainstream SRHR policy and planning. So the unintersectional lens helps us to identify that. It also helps us to identify these overlapping identities, which can either accord power, privilege, and freedoms. For example, enabling positive rights to SRHR services, medicines, and information. Intersectionality is also used to show the different experiences of discrimination that exist among different categories of minoritized youth with compounded vulnerabilities. For example, youth with disabilities, sex workers, and gender expansive youth in relation to access and utilization of SRHR. So when we look at it, when we look at SRHR from an intersectional point of view, we are able to dissect the different experiences of minoritized youth. Next slide, please. Through intersectional SRHR, we also identify how the intersecting vulnerabilities of minoritized youth exacerbate existing barriers and which systematic changes are needed to overcome them. So like I mentioned earlier, when we take an intersectional angle, we are able to see how the different vulnerabilities meet at access of power and how they are experienced by one individual. And when we identify that, we are able to strategize and work out ways in which such barriers can be addressed. And finally, an intersectional approach to SRHR allows us to question policymakers on who is being left behind, whose voices are unheard, who will be benefiting from the policy, and who will be adversely affected, thereby pushing for inclusive policies that offer equity and justice for those who are most marginalized. So when we go to the policymakers, when we go to advocate for the East Africa SRHR bill, we are not just saying, well, we need this bill because we need to reduce teenage pregnancies, whereas that is good and it's part of the goal, but we also want to ensure that minoritized youth are not left behind. So taking an intersectional SRHR approach really strengthens our advocacy, and it also enriches our message as we push for policy changes among our duty bearers. Thank you very much.
Thank you, Grace, for centering intersectionality for us and reminding us that we must address the root causes and not symptoms, the multiple identities, the power and privilege. And now I will now invite Caroline for the presentation on the website. Please just note your responses or questions in the chat. Thank you.
Yes, thank you, Maureen. And good morning, everybody. My name is Caroline. I work for WEMOS, and together with communication people from all partner organizations, we have been working on the Make Way website, and we would like to present that to you today. As you can see, this is the URL, make-way.org. I invite you all to have a look at the website. I think that's the best way to get to know the website, is to have a look around, but preferably after the webinar, because I will walk you through it very briefly as well. In order to do so, I'm just going to stop sharing for a moment. And I'm going to share my other screen. So this is the Make Way website. I hope you can all see it. As you can see, we made a website where we can collect all the knowledge and information that we have on intersectional lobby and advocacy for SRHR. So we wanted to share it with as many people as we can. The accessibility of the website was key for us. So we've built in a couple of features to help with that. As you can see, we have the text-to-speech functionality. There's an option to translate the website in any language that you would like. We've also made the website as light as possible so that also people with limited or slow internet connection can still use it. So we are currently on the home page that has the highlights of all the content that we have on the website itself. We obviously have an About Us where we explain more about the program, about the contexts in which the countries and the context in which we operate. We also share there a little bit more about who we are, the consortium partners. But probably more interesting are the resources and the recommended readings. So we have a list of resources made available on the website. This is not complete. We will continue to upload things here, including webinars, infographics, reports that we find interesting, a list of recommended reading as well to sources that we think, publications that we think are relevant and interesting and inspiring for you to use. Another thing that we have is news. So we have articles on our website that can be of news updates about the Make Way program. It's also a space where, for example, minoritized youth can speak out and share their experiences and their solutions. Other civil society organizations can share their experiences and their lessons learned, so we can put everything into context. Another thing that we have is an agenda. So we are going to fill this with events that are not only organized by Make Way, like trainings and webinars, but also of other major events that are going on that are relevant to us. I won't go into detail about the frequently asked questions and the contact because I think that speaks for itself. However, I did want to talk a little bit about the toolkit. So we have one of the major features of the website is the toolkit. I won't go into detail of the content of the toolkit because Lisa will do so after me. But I did want to share with you how it sits on the website so you know how it works. So we have the full toolkit here. And the toolkit has been divided into 9 different steps, lobby and advocacy steps. Those steps you can find here below. There's a description of each step. And some of these steps contain tools. So if you open a step, you can see different tools here. For example, the intersectionality 101 tool, you can open it to see the overview of the tool. So what is the goal of the tool? How does it enable intersectional SRHR advocacy? And who is this tool for? Now, if you find it interesting, you can go and visit the tool itself. There is the online version of the tool, which is what we are looking at right now. We also, taking the accessibility into account, made a light version of the tool. That means that the content remains the same, but the format is very, very light. And you can download it here in the top right corner. You can print it out if you would like. And of course, there's the option for feedback because we continue to work on these tools. Now, as I mentioned, this the content on the website will be continuously updated. So the toolkit, the resources, the agenda, the news articles, we will post new things on here regularly. And if you would like to stay updated about the different developments, you can follow us on social media. We will post about it on our social media channels. You can find our channels here if you go to the About Us page. You can find the different partners here, including their social media handles. So we will post about it whenever there is new content. And also, we would like to invite you to also contribute to the website. So if you have information, knowledge, if you have resources that you would like to share, then please let us know and we will be happy to upload it on our website. And I think that concludes it for the website. So again, I welcome you all to have a look around after the webinar. And if you have any questions, then please let us know. Thank you.
Caroline, I would describe the website as warm. I don't know what the rest think. It looks warm. There's something just warm about it. And this is a quiz to the rest of us. I don't know who'll get the coffee. The URL of the website, if you get it right, coffee and me. So we'll move to the next presentation by Lisa. Lisa will take the lead.
Yes, I will. Good morning, everybody. My name is Lisa Lichterink, and I work for WEMOS as well. And today I will be speaking a bit more to our toolkits that you've just already seen on the Makeway website. We want to give you a bit of an overview of what's in this toolkit, and then we want to also dive in a bit deeper with a small panel of some of the people that were involved in making and developing these tools, to really give you, hopefully inspire you all to start using the tools. But first I want to start with an overview. Next slide, please. So this toolkit is really a key building block of the Makeway theory of change. It is what we hope will catalyze our game-changing intersectional SRHR advocacy. It consists of different tools, as you've already seen in what Caroline has just shown you on the website. So it's different tools, and they all have slightly different purposes within the advocacy cycle. Next slide, please. So again, this is the lobby and advocacy cycle and the steps that we have outlined. So first, there is a before you start section, because we think you really need to do some groundwork first before you can start doing this intersectional SRHR advocacy. And then we have 8 other steps, which are issue analysis, setting your goals and objectives for advocacy, building your coalition, an intersectional coalition ideally, and consisting of many different people and groups from all kinds of different backgrounds. The 4th step is stakeholder power mapping. So who has the power around your advocacy goal? The steps on how then you put those goals into a really actionable plan, an advocacy plan. Alongside that, of course, comes a communication and media strategy. Very important, because advocacy and communications are very much interlinked. Of course, we need to implement it, and then we need to monitor and really learn about it as well. So we have 9 tools on the website currently. And I just want to walk you through 6 very quickly, and then there's 3 others we'll dive into a bit more deeply. So next slide. First tool is the self-assessment tool. This tool really helps to lay the foundation for applying an intersectional lens in SRHR advocacy. It is designed to help organizations and individuals gain insight into their own position, their own biases, privilege. It includes some sample surveys and instructions for conducting organizational reflection sessions. And good for maybe everybody to know is that Makeway partners have all completed this self-assessment in the past and have sort of created really actionable plans that include things around staff training, hiring policies, and values clarification. So the next tool is the Meaningful Youth Engagement Training Guide. So as we've spoken to it, young people are really at the core of the Makeway program. So therefore, we also have a tool that guides people on meaningful youth engagement. And it's about realizing youth engagement with young people in all their diversity. And it also includes exercise and explainers, as well as references to lots of existing fabulous material that is already out there. And I also want to emphasize that we really also try to reference resources that are already out there and not reinvent the wheel all by ourselves. The next tool that's also still in this before you start module is Intersectionality 101. So the primary tool of the primary purpose of this tool is really to demystify intersectionality. So Namataka has already taken us through it. So this gives you a bit more depth. It also provides lots of explainers, exercises, and resources to sort of deepen your understanding of intersectionality wherever you are in this understanding process, and sort of integrate it into your SRHR advocacy to promote a vision of everyone enjoying their SRHR freely. Then we have a couple of tools that are inside, more inside the lobby and advocacy process. So we have a checklist for budget analysis, which guides the user on monitoring and investigating budgets throughout the whole budget cycle. This tool really looks at how budget is allocated and also how you can build a process that is really inclusive of everybody who the budget affects. And then we have two communication tools. So there's an intersectional communication and media strategy tool, which really helps you to develop a really well-founded intersectional communication and media strategy for your lobby and advocacy works. It takes you through 10 steps, from setting an objective to constructing messages and picking your channels and the ways of how you want to get your message out there. And finally, we have a sixth tool on a checklist for accessible communication. So Caroline has already emphasized, of course, this accessibility is really important for Make Way. So this is a checklist that can help the user look at their communication and see how accessible is it for people that face different barriers in accessing communication, whether that's visual impairments or limited education. So it's a really helpful checklist to help you guide you through that process. Next slide. So maybe just a quick word before we get into our panel on why we chose these tools. So they're adaptations of existing tools where we really try to integrate this intersectional lens. They are based on program demand. For example, we have a few countries where there was a really high demand for doing budget analysis. So we also try to answer that demand and designed tools that really met the program need. Then we have lots of expertise of consortium partners. We, of course, have Akina Mama Africa, who really have a strong expertise on intersectionality. So they have designed this Intersectionality 101 tool. And we have the Circle, who have designed a tool with their religious and theological expertise in mind, which we'll talk about later in the panel discussion. Finally, we really have an intention to keep on improving and adapting these tools. They are not perfect. We really welcome your feedback on when you're using them, and hopefully together we can get to a really meaningful set of tools that can help us really realize this intersectional SRHR advocacy. Next slide. Now I want to get into our panel discussion. So we have three tools that I haven't mentioned yet. We have an intersectionality-based policy analysis tool, the intersectional C-Judge Act tool, and the intersectional community scorecard. So I want to ask Caroline to get our panel together so I can introduce everybody. All right. So welcome to our panelists. For today, we'll be speaking to these tools. So we have, for the intersectional C-Judge Act, we'll be having Professor Esther Mombo, as well as Adira Godfrey. Professor Esther Mombo is the Executive Director of the Circle Kenya, and Adira Godfrey is a researcher involved with the Circle. So what then we have for the intersectional community scorecard, we have Caroline Wambui, who is an innovations manager and deputy team lead for VSO International based in Kenya. And then finally, we will have Miria Kutsumpa, who's a global health advocate from VEMOS, who will speak to the intersectionality-based policy analysis tool. So for our first, we just want to get a first introduction. So Professor Mombo, can I just ask you to explain what your tool is about in, let's say, a minute for the audience?
Thank you so much for the opportunity, and congratulations to the comms team for a very good website. And I represent the SACO as you have introduced, and the SACO is a community of researchers in religion, culture, and women, and how both religion and culture impacts on women positively and negatively. Our tool, which is the Intersectional That Act, is a tool that uses the framework of religion and culture in analyzing issues around sexual reproductive health. The tool is an invitation to a safe space for people to engage in a difficult subject of their own community. The tool is intergenerational because it brings together the young and the old in talking about issues of intersectionality. The tool analyzes both the context of the people and the context of the religious texts that they are using. The tool employs texts because in a space where religion is very important for people, both as a faith action and both as a way in which they practice their faith, texts are important. And these texts are read in community and they are interpreted by community in relation to their own issues. And finally, the tool is a lobby and advocacy tool because it just doesn't end with what the issue is, but it ends with what do people do about the issue, and specifically on issues of reproductive health.
Thank you, Prof. Same question to Caroline Wambui. What is the Intersectional Community Scorecard about?
Thank you, Lisa. The Intersectional Community Scorecard is a social accountability tool that has been developed to create a platform for collaborative engagement between duty bearers and service users. And for it to be an intersectional community scorecard, we have ensured that young people and marginalized young people are at the center of the process. They are the persons that will take lead in the implementation of the scorecard. So the scorecard has 6 steps, which starts with the preparatory phase where you understand the context, and then you understand the laws and policies of their land, and then you conduct the evaluation with the young people, with the marginalized young people, and then you have an interface or a meeting where the young people are able to present the issues affecting them while accessing SRHR services to the duty bearers. So it creates a platform where they can collaboratively discuss what has come up as the gaps in accessing services in specific facilities, and they can collaboratively be part of the process. So it gives young marginalized people an opportunity to be part of the decision making and identifying the solutions that will make a difference in their lives. And also another thing that we have included to make it more intersectional is the AAAQ, the affordable, available, and acceptable quality services, SRHR services. So when the young people are talking about the gaps in their service provision, they also look at the AAAQ to be able to look at it holistically. So they give their feedback to duty bearers, and together with the duty bearers, they come up with tangible solutions that will improve their service provision and also satisfaction in the services that are offered in their localities. Thank you.
Thank you, Caroline, for that brief introduction to the scorecard. Miriam, same question to you, the intersectionality-based policy analysis tool. What's it about?
Thank you, Lisa. And again, congrats to all for the website. So I'll just say in a minute what's the intersectionality-based policy analysis tool about. I'm going to call it just policy analysis tool. So basically, it provides a roadmap to analyze the whole policy for the whole policy analysis process. And it enables the users of the tool to do a critical analysis of the policy of their choice, and ask the right questions on who is behind the policy, and think through some of the elements that when we do a regular policy analysis process, we might neglect. So it adds basically this intersectionality thinking into the policy analysis, and it helps us understand the underlying power dynamics of any policy, really. As Grace also said in her introduction to what intersectionality is, we're looking to the underlying power dynamics. Practically, the tool consists of 36 questions that cover all aspects of the policy-making process, from general question on what the policy is about and what are the perspectives around the policy, to how was the development process of the policy, the operationalization of a policy, the monitoring and evaluation, and the accountability around the policy. So it covers everything. So a user of the tool first needs to select which policy do we want to analyze, and bring together the people that you want to do your analysis with. And then you prioritize, because as I said, the questionnaire covers everything, but it doesn't mean that we need to cover everything every time that we use the tool. We prioritize based on what is our focus and what do we want to use out of the policy analysis for lobby and advocacy. So after collecting all the information, you start to put together the analysis in the form that best fits your advocacy goals and your target group. The tool also has an element of collaboration, because you can do this with other interested parties in the policy that you picked, and you can use the findings to develop an advocacy. So you can move forward in the advocacy showed us, and yeah, you can use the results of the analysis to inform the target groups that you have on opportunities and challenges that the policy offers. So it's a tool that can build your basis for lobbying advocacy for policy change, very briefly. Thanks.
Thank you, Miria, for that nice overview, and for everybody for keeping it concise, because then we have some more time to dig further into it. So, Professor Mombo, how was the C-Judge Act tool used to reveal gaps in people's sexual and reproductive health and rights?
The tool has been prepared, and it has been used, of course, to show how there are gaps in the sexual reproductive health rights. First, because religion is very, very strong among people in our societies, religion can be used as a weapon. It can also be used for liberation. And this tool was prepared to use a motif of liberation in view of helping people in the health sector to speak about the issues and also to find solutions for them. Because the tool was used in community, and because the tool was about community, and because it invited all members of community together, the tool was able to reveal what the health challenges are, especially in the health in sexual reproductive health. An example was the issues around sexual and gender-based violence, issues around rape, issues around teenage pregnancies. By reading a text that was about rape in the Holy Scriptures, it made the community to realize that the problem of rape is not just within their community. The problem has been there from time immemorial. But by reading a text like this, it helped them to note not only the visibility of the problem, but also ways in which they could address the problem. I'll ask Adera to add on this, please.
Thank you so much, Prof. I will mute my video because of my internet so that then I'm able to be heard well. So the question that we dealt with is scholarship proved that religion and culture were barriers to access to SRHR information and services. So then the aspect of how do we reappropriate religious and cultural scripts and language that are barriers, how do we reappropriate them so then religion becomes a tool for advocacy for access? And so the motive of reappropriation was very, very key. Basically then because religion has power to convene and to convince people. So how do we use the resource within religion then to convene and convince people about access to information and services regarding SRHR? Yeah.
Thank you both. I guess on a different note, Miria, we have just heard about the SRHR Act tool really looking at using this tool of religion and how it binds communities together and using that within SRHR advocacy. The policy analysis tool is quite different because it zooms in really on policy and policy-making processes. Can you share how that works in revealing gaps in people's SRHR and how you identify advocacy asks, perhaps with an example as well?
Yes, so by using the policy analysis tool, you can indeed reveal these sort of gaps. So, for example, the tool includes questions like who was involved in the development of a policy and who was left out in the development of a policy. So it's not only about the content of a policy, but it touches upon also the process and how the policy was designed. So already, if you look into this type of questions and you realize that, for example, in a policy, civil society was not consulted during the design, or the target population of a policy was not consulted, you already have a basis for an advocacy case on how inclusive the policy development was. In other aspects of the policy analysis tool, there are questions on how the people that are supposed to benefit from the policy are identified through the policy. So what kind of language is used there? And then you can already, with your intersectionality glasses on, see if the policy reaches everyone that is supposed to reach, or people are left behind because their identity is not recognized, it's not spelled out, it's not counted in a policy. And when I say policy, just to be clear, this can be an implementation plan as well. This can be a strategy. This can be a program of a donor. It doesn't, like, we use policy in the broad sense. So you can examine different documents with it. So yes, once you examine all these aspects, then you have your basis to build your recommendations and your advocacy asks, depending what is your goal. Is your goal about the process? Is your goal about the identity language? Is about the content, or is about the accountability mechanism of the policy?
And what have you used it for? What kind of a policy have you used it for?
So, for
what
example,
have you
found? We used it at some point to analyze a new framework that was developed by a global health initiative, the Global Financing Facility, which is a trust fund of the World Bank that is focusing on reproductive, maternal, neonatal, and adolescent health and nutrition. And they developed a strategy to assess how well donors are aligned with country priorities. So we said, okay, let's take this framework and analyze using the Makeway policy analysis tool. And we saw there already the lack of consultation in the development of the policy. And we also saw there how in the plan that they had, it was lacking focus, it was lacking inclusiveness of the people that are targeted. And this is the feedback that we brought to the Global Financing Facility, and it improved basically the framework.
Amazing. I think it's such a helpful tool, and also helps you just realize that policy is not set in stone, that it's really made by humans and therefore can also be changed by humans. So it's really empowering. Caroline, again, a very different tool that you have developed or adapted with your team. Can you explain a bit on how you've seen the scorecard revealing gaps in people's SRHR, and perhaps you can share something that you found surprising in this journey?
Okay. So the intersectional community scorecard is developed with the intention of revealing gaps in service delivery, and specifically SRHR service delivery. And what we do is we go to specific facilities with marginalized youth, and they score against the services that are offered in the facility. So we start with a rights awareness for the marginalized youth, so that they understand what they are entitled to. And with that knowledge, then they are able to give feedback to the services. So that is the main goal of the ICSC tool, to bring out the gaps, and therefore then to come up with ways that the solutions, ways to come up with solutions that are either homegrown or that they will make a difference in the services that the youth require in those facilities. So so first of all, it gives them a platform to be able to share their experiences. So you find that some of the youth will talk about, when they go to a facility, we come in, I am a young mother who also has a disability. When I go to the facility, I find that the health workers are not able to offer me services. So those are the kind of experiences that we get from utilizing the tool. And so together they sit down and come up with solutions that can be either handled at the facility level, but we also find that some are system gaps that need to go to another level. So they either need advocacy for them to be resolved, or they need a higher level of decision making. If it's financing, where we find sometimes they come to the facility, I want to get certain contraceptives, but I don't get them. That is definitely sometimes a financial system issue that will be handled differently. So those are the kind of gaps that we find, and solutions that are able to come up. What is surprising is sometimes we find that there are things that already the intersectional component is there. So like in one of the facilities that we went to in Kilifi, we found that the health workers were already trying to reach out to marginalized teenage mothers who are not coming. They usually have like some sort of outreaches where they teach young people about sexuality and seeking services, but they found that they were going to areas where the most marginalized would be, but they were not putting more effort beyond going where they are able to access them. So we found that there are efforts. That was surprising for them and for us, that they're already inputting the intersectional concept of thinking about who is not likely to come and where can we hold this outreach for them to be able to come. So those are some of the things that we found. We also found that it was an eye opener to the duty bearers, very positive in some parts. They said, oh, I have never thought about how I think about disability, I think about teenage mothers, but I've never thought about a person being a disabled teenage mother and who is not able to read and write, and how the way I offer services may affect them or may make them feel more marginalized than they already are. So it was an eye opener for them in that way. And what for me, I felt like it then gives an opportunity. It shows that the solutions are there within the community. They won't not come out from external places. What we need is to bring the awareness we just need to bring the awareness, but the solutions are there. They are homegrown. It's possible to achieve what we are looking for. Yeah.
Thank you, Caroline. And it's really wonderful that you've been able to give this sort of platform and empowering space for young people to share these experiences with the duty bearers. So I guess I have a follow-up practical question, which is still to you, Caroline. Can anybody use this tool? Do you need specific training? What's the process? Can I use it tomorrow in my local hospital?
Well, yes, anybody can use the tool. It is developed for SRHR implementers, community groups, youth groups. It can be youth-led. We have developed a facilitator's guide. What you need is, it needs to be facilitated. The process needs to be facilitated. And for that, we have developed a facilitator's guide that is one in detail form and also in a user-friendly version that is accessible. What you require to be able to be, as a first-time user who has no knowledge on social accountability or who hasn't experienced such a tool before, you would require a facilitator's training to be able to articulately utilize the tool and bring on board the people that are most needed in the process. So as VSO, we are offering that training to people who are willing and are able to willing to conduct the ICSE process. So yes, you can, but you can do it tomorrow because you would require training.
Right. So same question to you, Professor Momba. What's the process for the CJudge Act tool? Do we need training? Who can use it? Do we need a degree in theology?
Thank you so much. You do not need a degree in theology, but you need to be trained on how to facilitate. This tool is one that can be used by all groups in a community. All you require is a facilitator. The facilitator has to go through a training on how to facilitate, because the tool provides a space to analyze the people's context so they see what is going on and they bring out the issue. And the second one is they judge why the situation is the way it is. And thirdly, then they take action. So the facilitator has to be trained on how to guide the community in terms of what they see, in terms of how they interpret what we see, and how they can take action. The facilitator is not an expert of all the community issues, and especially on sexual reproductive health, but the facilitator is able to guide the process of evaluating, the process of analyzing, and the process of action. So tomorrow you will not use the training manual, but tomorrow you can be trained as a facilitator.
Thank you, Professor. Miria, what about the policy analysis tool?
The policy analysis tool, I mean, it's quite self-explanatory.
Mm-hmm.
So obviously, if someone has experience in the process of policy making and the process of policy analysis, it's much more straightforward to use the tool with the guidelines that we have provided. If someone is new in policy analysis, then maybe some support might be needed to be able to navigate through the questions and understand how to also make the selection of where do we focus based on what our advocacy target is. But overall, it's a quite self-explanatory tool that it's easy to use by everyone.
Great.
And
of course,
the important thing to note, is that you can use the tool in any way to the extent that is useful for you. It's not necessary in every application of the tool that you answer each and every one of the questions of the questionnaire.
Yeah. And I think I have stressed in my previous presentation also that we really value feedback and we try to incorporate it and adapt the tools. Have you done that already with the intersectionality-based policy analysis tool?
We have not, well, we did some adaptation from the very first draft that we had started after we put it into practice internally. Then we made some adaptation to make some questions more clear and more easy to understand. We have not made any major adaptations since, but this is something that we highlight every time that we share the tool, that we are open to receive feedback and make adaptations as we go.
Yeah, I think it's key. And Caroline, I can imagine that with your extensive testing, you have done some adaptations along the way with the feedback you've received.
Yes, we have. We started with a pre-test session time where we went to the field and we tested the tool and to see whether does it actually bring out the voices of the most marginalized, does it encourage them to participate in the process, and we were able to get feedback, and one of them is to improve on the safety and security, and also the documentation processes for some to reduce the text that was in the document and make it easier to utilize. And that then we developed the user-friendly version of the document, but also to ensure that we don't put anybody at harm. We had thought that by putting the young people in a safe space, that then ensured that they were safe. But there are some groups that are that experience hostility in different contexts, and therefore there's need to put that in mind. Also the financial aspect of it, which we were able to include in the document, that you need to budget fully for it, because sometimes it's in some areas it's it costs more in different contexts, so you need to plan for it. So those are some of the feedback that we got and we put in place.
Yeah, and great that you were able to incorporate that. And Professor Mombo, or perhaps Adira can speak to it as well. Have you been adapting the tool based on the feedback you received while testing it and using it?
Adira?
Yes, and one of the feedbacks that we've received so far in our many spaces is that we are using largely Christian scriptures and tradition, but there are multiple religions, there are other religious texts. And so what we are doing is we are inviting people so that we can begin to analyze other religious texts beyond the Christian text and just a cultural scripts. So that is work that is going on currently. But the second issue is shock, because people did not expect that religious script, religious text could be used to talk about SRHR issues. And so how I've dealt with that shock, how making it a safe space, a conversation that is safe, where we are able to deal with some of those responses. People are getting shocked that you could use the Bible to talk about things that they have known before cannot be analyzed using scriptures. So moving forward, creating it as a safe space for everybody to be able to respectfully use their religious traditions to talk about these issues. Yeah.
Thank you, Adira. And yeah, I'm looking forward to further adaptations for every tool, because I just want to emphasize this again, that this is really important for the Make Way program, that we receive your feedback. So on the website, there's also a feature where you can provide us with feedback, negative or positive, or yeah, room for improvement, I think is always there. So please use that function so we can keep on improving the tools with all of you. We will have some time also for some further questions during our general Q&A, but to just close this wonderful panel, I just want to give every panelist some room to basically tell the audience, why should people use your tool? What makes it unique? Professor Mombo, you can go first if you want.
Okay, I'll ask Adira to do the publicity bit now.
Perfect.
Thank you so much. So you realize that for a very long time, and this has been proven by scholarship, that religion and culture are still barriers to access of information and services regarding SRHR. And so this tool is very important in changing that narrative reappropriating religious scripts and narratives to enable access to these services and information. And secondly, the aspect of intergenerational dialogue. It brings in young people, it brings in children and old people in a space of dialogue. So these two things are critical, that we can use religion positively. But number two, that we can bring everyone on board for this kind of very necessary dialogue in our time. Yeah.
And finally, we can use religion for lobby and advocacy for social justice issues, and especially on sexual reproductive health.
Thank you both. I think that's very powerful. Miria.
My moment for my pitch.
Yes.
So just a few words as for the intersectionality-based policy analysis tool. I see it a bit as a way to humanize policy making, if I can use this phrase. So, I mean, to put the human element into a process that can be rather technocratic, and even a bit, you know, to bring policy analysis closer to the people that want to do lobby and advocacy for SRHR. And it's not as scary as it seems. Like, with a proper framework and with the right questions, you can go deep into a policy and find out what you want to change. And to close, the policy analysis tool of Makeway can shift a bit our thinking when we do policy analysis and put the goal of leaving no one behind at the center of every policy analysis, and by extension at the center of our lobby and advocacy, to bring this to the policy change that we want to see happening.
Amazing. Thanks, Miria. Caroline? Why should people use the scorecard?
I think most programs and Makeway as well talk about marginalized youth and people who are excluded. But this tool helps us to know who are these people, and not just who are they. It identifies them and brings them at the center of this process, on the process of decision making, in the process of giving feedback to duty bearers. It looks at people who are more often than not included in processes. When we went to put it into practice, we found that most of the young people were telling us, this is the first time that I have seen a person asking me about the services that I'm offered in certain facilities, even the ones that are in my locality. It is the first opportunity for them to give feedback to duty bearers. So it is a powerful tool in the sense that it gives voice to the most marginalized and those who are overlooked in decision making. It puts them in a position where they can share their lived experiences in accessing SRHR services, and they can participate in solutions that directly speak to their need. And also, if well done, it can kickstart the process of leaving no one behind, because then it brings the ones who have traditionally been left behind. Thank you.
Thank you, Caroline. And I like that you stress these lived experiences, because those are so key, I think, in all of this work. So thanks to all the wonderful panelists. I'm really looking forward to hear everyone's experiences using these tools, not just the ones presented in the panel, but also the other ones that I just very briefly introduced. So please go have a look. I think we'll invite some more questions during the general Q&A, but for now, I'm going to hand it back over to Maureen.
Thank you very much, Lisa. Thank you very much, Lisa, for a very engaging panel discussion. And to our panelists as well, thank you very much for giving us insight into really understanding the tools and how we can use them for our lobby and advocacy. We're now in an open session where, responses, what stood out for you, or if there are queries. Maybe I'll start with a question. There's a question for Professor Mumbo. How does the tool address difficult religious texts and cultural practices that seem to hinder the progress of SRHR without altering the religious beliefs or putting down the cultural beliefs? And the person has asked that maybe we give examples that have been encountered in addressing SRHR using difficult religious texts.
Okay. Thank you so much for the question, and thank you, Maureen, for the question. Let me begin by saying that, of course, religious texts are difficult texts to begin with, and some of them appear to show the realities of society, and especially around sexual reproductive health rights. One of the things in terms of thinking about religious texts is to know that those texts are interpreted, and sometimes the interpretations can be ideological. If I use the text of the Christians, for example, the Bible, I do know that people approach the Bible with a lot of fear and with a way of just trusting the Bible as it is. And sometimes those who interpret the text interpret it from a perspective of privilege and dominance, and sometimes from a perspective of identifying issues around morality, but morality in a one way. And so when we use the intersectional C-Judge Act, it is trying to bring to light what has been said with other people, what are the lived realities of the people, and how do the text affirm the people rather than the text destroying the people. The idea that the text will do away with our culture is one that is not really true, because culture is also not, culture can affirm and culture can be affirmed. So what we do in this process or with this tool is to ensure that the power within the text and the power within the culture is interrogated, and it is used positively rather than negatively. When we say that we are going to go against the text or going against the culture, that is ideological in many ways, because what the text is supposed to do is to affirm life. Because when we think of why we exist in terms of our religious faith, we exist because God, who has created us, is a God of justice. And God expects us to live a life that is abundant. But there are aspects within society that do not allow people to live life in an abundant way. And so the C-Judge Act is to reveal those things and to be able to challenge those things for people to live an abundant life. I think that's what I can say at the moment, but I can also ask Adera to add.
Thank you. Just on the second part of altering, beliefs and cultural practices, and I ask why not? Because if the belief system, or if what people have been made to believe is not life affirming, is promoting injustice, why not engage them to alter those beliefs? So the intention is not to make people quit their religious beliefs or something, but is to challenge beliefs that perpetuate injustice and violence against people. So the question of altering those beliefs is why not? Because what then are they achieving? Yeah.
Thank you. Any other query? I think some were answered in relation to the intersectionalized community scorecard. Caroline answered some of those questions. I'm trying to see if there's any that remains unanswered. We have done very well on time. So we still have a few minutes where we could just, give feedback. Either we can do it. I'm just looking at the chats. The intersectionalist community scorecard, an amazing tool, drawing out the different binaries of different youth and helps map the most affected. I'm just seeing, there's another one on, there are others who are interested in having a session on the ISJA tool, and just to be able to experience how it works and how it addresses matters to do with SRHR. So the circle, I think we have some work there, see how best we can enable others also experience the use of a tool. Yeah, I'd like to participate in a session and see the ISJA tool in action. Somebody says me too and me too. There's several me too. I think there are 4 me toos. Okay, very powerful tool. Thank you to our panelists. All right, one more, let me see. Okay. All these tools will be on the website, yes, they will be on the website. I was supposed to give some coffee. URL for the website. Who can get it? Who remembers it? You can put it on the chat. Or yeah, somebody also wants to see the ISJ tool in action. Okay, circle. We have an assignment there. Aha, all right. So you get it. I don't know whether you'll be coming for the annual reflection session, then you can get your coffee. All right, sorry, let me just stop this. Okay. Okay. Oh, virtual. Virtual coffee. That'll be interesting. All right. If we do not have any additional feedback or responses or questions, I'd like to bring this to a close and to thank each one of you for making time and for being actively engaged in this process. To the comms team, especially Caroline, I'm really delighted that I got a chance to work with you on the tail end of this. Caroline, well done. Thank you so much for this effort. We don't take it for granted. I mean, by the time all this information is put together, you have been burning the midnight oil and many hours of work. So thank you so much for being able to put this together, and the entire comms team and the Makeway team, the entire Makeway team. Now we have work, we have the tools, we have our lobby and advocacy plans. So we really need to get into the trenches and address some of those issues that we did mention, that we need to get to the root causes rather than addressing the symptoms. So we have quite a bit in this year and the year to come, the remaining years of the program, so that by the time we come to the end of the program, we're able to measure what has been accomplished. So there being no other business, can we call it, can we adjourn? Thank you. I can see I've been, for your commendations, I really appreciate. Thank you very much. And thank you, comms team, for giving me an opportunity to do this. I really appreciate. And as I said, my voice is usually very melodious, but the cold conspired. Thank you very much. Okay, so I think we can bring it to a close. Thank you.